So I am Dr. Aniruddha Mahindrakar from Mumbai, Andheri, and I will be discussing about the newer dimensions in the management of floaters in the eye. So floaters and its management. We all know floaters are very irritating and one of the most commonly presented complaints by the patients. So what is more important, we will be going through in this in a specific way. First the floaters, then the pathophysiology, then the treatment. So that's how we will follow in this. So aging is a very important process in this. Aging is a gradual and continuous process of natural change that results from the impact of accumulation of a wide variety of molecular and cellular damage. Eye diseases which are because of aging are glaucomatous changes, cataractous changes, even pterygium sometimes, even dry eye, blepharitis in fact, and the most relevant today is the eye floaters. So what we need to understand for eye floaters is more important about the vitreous. So vitreous consists majority of water, which is 98 to 99%. And the remaining is collagen fibers and hyaluronic acid. However, we need to know that this collagen fibers and hyaluronic acid is the most important thing. And it is the one which is making the water to be firmly held in the vitreous, making the vitreous a solid, firm globe-like structure and hence maintaining the eyeball. So what is the composition of vitreous? This is how the gel is held. Though it is made of water, we know water does not escape because of the other components, which are primarily made up of amino acids, fats, vitamins, and hyaluronic acid. Now we come on to what are eye floaters. Eye floaters are spots in vision that look like black or gray specks or strings that drift across the eyes. Floaters usually are small flecks of protein sometimes. We can call them as collagen changes. So this is how the vision is in the normal eye. But in an eye with floaters, when the light is passing inside, it gets obstructed because of the floater, and so the other rays of light reach, whereas this ray is not reaching. This casts a shadow on the retina, which is seen by the patient as a floater. So the floaters can be seen as how the architecture is. It can be sometimes dots, it can be squiggly lines, it can be ring shapes, there can be thread-like strands, or there can be cobwebs. This is a picture wherein the patient is seeing how the floater looks like. We can see here. Now, we know that vitreous syneresis and posterior vitreous detachment, these are the most important causes of eye floaters related to aging. However, there are a large number of abnormalities in the eyes that may also cause symptoms of eye floaters. So anything that is obstructing the light, that is any cellular material within the vitreous may cause eye floaters. So these can be either red blood cells, which are because of hemorrhage, and white blood cells, which are because of inflammation. So what can be the causes of hemorrhage? That is any injury, diabetic eye disease, retinal tear, because of which involves the blood vessel, or even a surgical treatment. What can be the causes of inflammation? It can be non-infectious uveitis, again an injury, which can be penetrating or blunt, an infection in the eye, or an eye surgery. So these all can be pathological causes of floaters. So these are the lists. So why is floaters important? A patient who develops new floaters must definitely get an eye examination to rule out the retinal tear or other pathological causes like hemorrhage or inflammation. So this is to ensure that no disease that can be treated to prevent permanent vision loss. So while neither flashes nor floaters typically cause any harm other than irritation or annoyance to the patient, they may signal a serious retinal condition which is underlying, particularly in patients with a recent onset. So this is very important, recent onset, which can be the hallmark of vitreous humor separating from the retina. Vitreous humor separation, that is PVD, may ultimately lead to a retinal tear or detachment, which does not cause pain, but which can cause permanent loss of vision. So now we'll go on to the pathophysiological occurrences. How does aging affect? So aging causes changes in the jelly-like substance of the vitreous that leads to liquefaction in the vitreous. As a result of this deterioration process, the protein fibers in the vitreous tend to shrink and they clump together. Because of this, slowly the vitreous starts to separate from the retina. So these were the causes that we just discussed, and these intrinsic phenomena. So that is called as entoptic phenomena, visual effects whose source is within the eye. So we just saw aging and myopia, also increased oxidative stress, changes in collagen and hyaluronan bond, gel liquefaction, fibrous degeneration, even the collapse of the vitreous body, all these cause floaters. So aging causes the amino acids and minerals to degenerate, and then there starts to be spaces forming which lead to a shadow formation on retina and affects the vision. So why are floaters important? Floaters themselves, as we just discussed, do not cause anything by themselves. However, they can be a harbinger, or they can be an indicator of some underlying disease. So also floaters themselves sometimes can cause poor quality of life in a patient. So what are the current line of treatment? We have to just observe and counsel the patient and tell him that don't worry, everything is fine. Or sometimes we can do laser, and even a surgical procedure can be done. So how observation helps? Floaters usually settle down on their own, and the patient may neuroadapt to them. So if the patient is getting adapted, great, nothing else to do. If the patient does not adapt, if he is not happy, then we have treatment options. There are now some oral treatment options also available. There are some great studies which are showing that antioxidant degeneration and vitreoretinopathy can be changed. So focus of roles on exogenous micronutrients like vitamin C, amino acids, GSH, these can be used as antioxidants because vitreous body is laden with antioxidants that could protect against the oxidative stress. We saw oxidative stress is one of the most important causes of the vitreous degeneration. So what was the highlight? Vitreous accumulates high concentration of hydrosoluble antioxidants, which has a damaging effect on ROS produced in response to stress. Amino acids used in ocular developments and functions as antioxidants. GSH inhibits degradation of hyaluronic acid and removes oxygen radicals, helps in recycling of vitamin C and E. These are not synthesized in the body. Their concentration is 33 times higher in vitreous when compared to plasma. It consumes free oxygen, thus reducing oxidative stress, and serves as a cofactor to number of enzymes involved in collagen synthesis. So what is the conclusion? Adequate antioxidant levels proves protective against vitreous degeneration, possibly preventing and improving myodysopsia and other vitreoretinopathies. Second study, which has been published in Experimental Eye Research in May 18, suggests that micronutrients like proline, lysine, glycine show protective role against PDR. So what was the study? It was conducted to estimate the amino acid levels in the vitreous of patients with PDR and to correlate it with adiponectin levels. So in this study, there were two groups, one group having 30 patients and the other group having 20 patients. This had PDR, patients with vitrectomy undergone, and this had patients with macular hole. So the pro-angiogenic molecules like vascular endothelial growth factor, anti-angiogenic molecules, epithelial-derived factor were measured. The redox status of the cell were assessed by nuclear factor, erythrocyte 2, mitochondrial antioxidant, uncoupling protein 2, vitreous amino acids were separated and quantified using HPLC. Adiponectin secretion and related gene when exposed to bovine retinal pericyte, angiogenic and oxidative stress were evaluated. So what was the result? Amino acids significantly elevated in PDR patients as compared to macular hole patients. VEGF expression was significantly decreased in amino acid patients. Cells treated with amino acids showed twofold or threefold increase in adiponectin expression. So amino acids exhibit a protective role against PDR by increasing antioxidant potential and decreasing the angiogenic markers. This is very, very important. The amino acids are shown in this study. Now, the next study, which shows hydrosoluble micronutrients has potential to improve the quality of vision. So this was published in Brain and Ocular Nutrition in July 18. So this had 463 vitreous floater patients with a good sample size of female to male, and 3 months once a day treatment was done. The result, statistically significant improvement was found in quality of vision after amino acids and vitamin C supplementation in 90% patients. Supplementation of amino acids and vitamin C in vitreous floater subjects showed relevant relief of floater disturbance. Improvement of vision quality was observed in all age groups. This is a very, very important study showing the significance of, again, amino acids and vitamin C. So how do these micronutrients cross the blood retinal barrier? This is an obvious question. We will have blood retinal barrier which will inhibit or stop other agents from going into the retina. However, studies have shown that micronutrients do cross the blood retinal barrier. That is glycine. It is carried via a carrier mediated transport. GlyT1 likely mediates glycine transport. Then vitamin E via scavenger receptor class B type 1 of inner and outer retinal blood retinal barrier. Magnesium actively transported across the blood retinal barrier. Histidine via carrier mediated transport process amino acid transporter. L-proline via system A, most likely A to A. So what is the importance? Eye floater is a severe vision issue for some patients, and they can be disturbing to the personal life, ultimately affecting the quality of life. Currently, there are no known medical treatments for eye floaters. However, supplementation with amino acids, vitamins, and minerals will definitely play a significant role in the oral treatment options to reduce the associated symptoms and even hence the complications associated with eye floaters. The other options of treatment are laser therapy. Nd:YAG laser therapy is a popular treatment option. It cannot actually treat the floaters. What does it do? It treats certain types of floaters by breaking them into smaller floaters. The risks are not so well known, but it is a reasonably safe procedure. The other option is also a surgical treatment. So this was a patient who actually had pathological type of floater because of the vitreous hemorrhage. He was a diabetic patient, and vitrectomy helped this patient significantly by reducing his floaters. So these type of secondary floaters, which are because of vitreous hemorrhage and other causes, can definitely be treated with floaters. However, even for age-related floaters, vitrectomy is nowadays being performed. That is called as floater-only vitrectomy. It removes the vitreous. It actually need not be seeing the floater, but it is effective in almost all cases. In this, the risks are known. It is as safe or safer than even cataract surgery, especially with the 23 gauge type of surgery. Blindness from infection or even retinal tear and retinal detachment, the incidence is very, very low, less than this, and it can be almost similar to cataract surgery. So it is basically a core vitrectomy, and a retinal surgeon can easily perform it. In fact, it is very, very easy. Induction of PVD in a case of vitrectomy for floater, I will be not definitely sure whether to do it or no, but many times I personally do not do it because there is some risk of retinal tear associated with PVD induction. There are other agents like ochriplasmin which are given by injection, but this is not available again in India. There is a premacular bursa, which is not an issue if vitrectomy is done. So this is a small study which we have done about 23 gauge pars plana vitrectomy for symptomatic floaters. Here we study the safety and efficacy of 23 gauge pars plana vitrectomy. Inclusions: the patients are symptomatic vitreous floaters which cause detrimental impairment to their daily functional activities. Most patients were examined for multiple visits, and they were properly counseled about the risks, benefits, and alternatives to pars plana vitrectomy. Patients were excluded if they had any other underlying abnormalities like epiretinal membrane, VMT, RD, vitreous hemorrhage, or inflammation. Core vitrectomy was performed. Here we had induced PVD, and extensive search of retinal breaks was done. So 18 months of follow-up was done. Mean age was 63. Male to female ratio was almost same. So the mean logarithm logmar vision improved. The Snellen's visual acuity had also improved from 618 to 69. The quality of life questionnaire was also done, and there was a significant improvement with 96% patients saying satisfied and 85% patients showing a complete success. Complete success was defined as freedom from the symptoms. So operative procedure was either there was a vitrectomy, a core vitrectomy with, if there is a pre-existing PVD, nothing, but if there is no PVD, then PVD induction was done. Fortunately, none developed a retinal tear. There was in the PVD group, iatrogenic retinal break occurred in a non-PVD patient and it was treated with laser barrage. There were cases of cystoid macular edema postoperatively and vitreous haze was seen for initial few days. But both these patients, all these patients had improvement within 1 month. There were no serious complications post-vitrectomy. So our study showed that sutureless 23G vitrectomy decreases the surgically induced trauma, operative time and even inflammation, good rapid recovery, and helps in giving significant improvement in visual acuity in patients who had severity, very high severity of symptoms. All patients had impaired quality of life initially, which had improved later on. So there was low complication rate, there was low iatrogenic retinal tear, there were no other complications apart from this, and there was high patient satisfaction. So the limitations is that it's a retrospective study, there can be a selection bias, it is a very small limited patient population and difficulty in determining the presence or absence of preoperative PVD. The patients in this study underwent a survey many months after the procedure, so recall bias for the quality of life survey might be questionable. Patients with an active lifestyle combined with a desire to improve their quality of life tend to present more often regardless of their profession. So those patients who have a impaired quality of life come. So as vitreoretinal specialists, we should be increasingly sensitive to patients' subjective visual symptoms and visual complaints. We should not just ignore them. Now we have treatment options wherein we can even prescribe them these oral supplements which have a good nutrient components, and it will definitely help the patients in improving their symptoms. At the same time, some patients can be chosen for the sutureless pars plana vitrectomy, which will be helpful in alleviating their frustration and improving their quality of life. Thank you.
Very nice talk, Aniruddha.
Yeah.
So how often we are considering vitrectomy?
No, it's quite rare. In fact, very rare, you can say. So vitrectomies or even any surgical procedure in a vitreous floater patient is very, very, very rare. In fact, vitreous floater patients to a retina surgeon's practice are like those dry eye patients in anterior segment practice. Every second patient might be having vitreous floater. So we have to do a lot of effort to see the periphery, everything, and then just talk to the patient, counsel the patient that everything is fine, just wait. And patients are usually happy if we tell them that oral prescription medicines will definitely help and waiting and watching will definitely help the patients. So that is usually my approach to the vitrectomy patients. And with availability of these newer medicines for floater, it's actually a great thing. So these newer developments are helping the patient significantly. Yeah, Dr. Manoj.
Yeah, tell me. As we are discussing, I'm sitting with a patient who's complaining of floaters. I'm in my OPD.
Okay. So, yeah, I was just going to ask you the same thing. What is your personal experience about floaters and how do you manage floaters? So, what is your approach to treating patients?
Conservative management.
Yeah. So, So I think that's the best way of managing the patients, and we have now a good line of newer advanced treatment options wherein we can prescribe them oral treatment also. So many times even psychologically they feel better and they are happy. So what is the follow-up that you ask these floater patients, sir?
Always educate them about signs and symptoms of RD.
Yeah.
Two ways to look at it. Very symptomatic patient, I have followed them after 3 weeks.
Yeah. And yeah.
Yeah. Please go ahead. You're
Yeah.
talking something.
No, yeah, please finish the next question that I want to ask. Yeah.
Yeah. And then the patient is not very symptomatic, then maybe every 3 months or so.
Yeah.
But so about 3 weeks back or 3 to 4 weeks back, we had a patient who was referred to one clinic in one eye who had a laser HST.
Yeah.
And the other eye, one colleague of mine saw, and then she said nothing to be done because of COVID. They were scared to dilate, and this patient had COVID about 2 weeks back, before having a symptomatic floater, presentation.
Yeah.
Within 24 hours,
Okay.
from the onset of symptom of floater, he developed a macula on RD.
Oh.
So the clue was the other eye had a big HST, which has already been well lasered by me. So
Yeah.
the thing is, what I request everyone, as you rightly mentioned, dilate the patient and see them thoroughly. That is a trick.
Yeah.
Sometimes we can even prevent retinal detachments. Do a good laser and warn the patient, give them 2-3 weeks of rest with adequate posturing and all. Can go in a long way. Yeah. So that is what I wanted to say. It just happened recently in our experience. Like, we had many experience like this. I'm sure you also must have had, but this was just a recent in COVID times.
Yeah. I think that was a very, very important point that Dr. Manoj highlighted from his personal experience, that every patient with floater should be taken seriously, should undergo proper dilated examination, preferably by a retina specialist who can do a peripheral examination and depression and look for any early signs so that we can prevent the complications from occurring. Yeah, now, Dr. Manoj, also about so we are on the newer approaches or newer development. So in diagnostics, do you think any of these wide field fundus cameras will help in identifying peripheral lesions in patients with floaters earlier than just manual examination, if cost considerations are kept away?
No, I don't think so. The only thing is that unless and until the patient develop a lattice with a hole on RD or an HST, then only will be picked up. Picking up vitreous lesions with this wide field imaging still is a challenge. If at all, it's just a vitreous problem.
Yeah.
And what happens is the peripheral view, whatever said and done, I was fortunate to be part enough to be, to give some insights in the development of Optos as well about in 2011, 2012.
Yes.
Whatever is said and done, it cannot pick up the 3D resolution of a peripheral retina.
Yeah.
Main retina, center portion is okay. So there's where most of the problem lies, and that's a big challenge. However, said and done, I think there was a small subgroup analysis study done by Shankar Mitrala group in which they showed almost 35% increase in the treatable peripheral lesions on wide field imaging. As a routine screening tool, patients walking in any retina OPD and gone into wide field imaging.
Okay.
So 35% increase in the peripheral retinal lesions. That's a big number.
Yeah.
So this is what we need to, and these are all patients who are either symptomatic or asymptomatic, and they needed treatment. In fact, they have shown in one patient where the HST just evolved as a retinal detachment, and timely barrage saved the patients undergoing a surgery. So these are all things, and I think all these supplements like Vitrion and all will definitely play a role here. You have a HST and then you have barrage it well. Now you want the PVD to occur, so some kind of vitriolysis, pharmacological vitriolysis should happen, and then you can save this eyes.
Yeah.
So this is what I think Vitrion and all will be quite promising, at least for this subset of patients.
So that's again a very good point highlighted by sir, that this newer diagnostic equipment plus the newer treatment modalities are helping us in identifying the patients quite before they develop severe disease and thus helping in reducing the complications and visual problems that can occur in the patient. So a patient who would have developed detachment and required surgery with suboptimal visual outcome will have a great outcome with almost normal vision if he undergoes just laser barrage, because of the recent developments and newer modalities of diagnosis as well as non-invasive, that is oral treatment.
The second thing which I wanted to highlight is the placebo effect of these drugs. You see a patient with floaters, you don't give him anything, he will always doubt you.
Yes.
Yeah.
That's true.
Yeah, so with a very good placebo effect of all these medicines, especially I will say, it goes along. Even if you give them a lubricant, they will be much more happier than not receiving anything.
Yes.
So
No,
that is.
this is also again very, very important point, that the patient is really concerned about his own condition, and when the doctor is taking him seriously and giving him medicine, it definitely helps him. The medicine also works, but sometimes even if the medicine is not working, the patient feels happy, and that feeling itself gives a symptomatic improvement in this patient. And neuroadaptability is, I think, that is what works in these patients when you have prescribed these medicines to the patient. That these are very, very important points that sir is pointing out. Regarding sir, crocin and those factors that I was asking you, your personal experience or anything you will like to share?
I have not used it as such. I think in near future, Sunways is going to launch the product, maybe post AIOS. That's what they told us. So we will looking forward to it. But definitely, we are, as all of us are core retina specialists, so we feel that something else is going on beyond this. So we need multi-targeted therapy rather than just sitting with one anti-VEGF or a steroid or whatever. Maybe a AREDS2 supplementation and long. These trials are long overdue.
Yeah.
I think because lack of pharma support or financial support, somehow these don't get underway.
Yes.
But we need to look at patients as a whole with a holistic approach and give them much more additional benefits. Definitely, once you have this kind of vascular disorders or neuro, something beyond the treatment horizon what we already have in hand.
Yes. I think are you still there, sir? Yeah. I think these are.
I'm very much there. I'm very,
I think these are really nice new medicines that are coming up, or you can say supplements that are coming up, because in today's stressful life, today's lifestyle wherein many of our people who are having to skip their meals, have to eat outside, don't get proper adequate diet, adequate nutrition. So these ingredients, in fact, saffron has been there in our cultural, what you can say, cultural diet for so long. And we now see how important it is, similar to turmeric and other things that were there in our diet, and they were really helpful in keeping us healthy. So I think all of these new developments will definitely help us to treat our patients and to prevent them from getting